Governor Janet Mills visited a vaccine clinic in Bath this morning.
Parents and school bus drivers brought students to a gym at Morris High School. RSU-1 officials say about 110 children got their first doses of the Pfizer vaccine today, exceeding the 100 or so who attended one for older students earlier in the year. They added the timing couldn't be more ideal, with Maine's COVID case records hitting a new high week.
It makes it even more exciting knowing that we're able to do this when we have more cases than ever, and hopefully it will protect even more of our community.
A year ago at this time, we were begging for this, we were waiting for this, we were hoping and praying for this, and now we have it, and that's exciting.
So far, more than 18,000 Maine children ages 5 to 11 have received a first COVID-19 vaccine dose, according to the Maine CDC.
So-called long COVID is emerging as one of the biggest health problems during the pandemic. Studies now show that more than 40% of patients worldwide have lingering, often debilitating symptoms months after their initial infection. Finding answers is the focus of a new nationwide study to get underway next month. And as News Center Maine's Vivian Lee reports, researchers at MaineHealth will lead the way.
In March of 2020, Kate Mueller started experiencing what she thought was pneumonia. She had shortness of breath, fever, body aches, loss of taste and smell, and exhaustion. The symptoms got better for about a month, and then
the wheels just sort of came off, and it was like I almost got sick all over again, except much worse.
In the early days of the pandemic, tests for COVID-19 were very limited. Weeks later, when she was able to get one, it came back negative. Mueller, who had previously competed in triathlons and through hikes on the Appalachian Trail, found herself being unable to get out of bed. Numerous specialists found nothing wrong. Eventually, it was determined that Mueller had long COVID. The symptoms include joint pain, headaches, fatigue, and brain fog, anxiety, depression, fevers, chronic cough, and sleep problems. New and recurring symptoms as well that continue months after acute infection.
Now, the CDC says long COVID can affect more than a third of all patients, but scientists say there's still so much that's not known. There are no treatments approved that are available and no tests to diagnose it.
Now, 2 months after having the infection, I still have no taste, no smell, absolutely zero.
Dr. Hagen Blasek is a pathologist who came down with COVID-19 in September. Vaccinated back in January, he got a breakthrough infection most likely caused by the Delta variant. He still has persistent brain fog, fatigue, and other symptoms and wonders how long they will go on.
Will I be okay 6 months from now, or will it never be okay?
Researchers from the state's largest health system are hoping to find answers to one of the biggest medical mysteries of the pandemic, the cause of long COVID, and why does it impact such a wide range of patients, from breakthrough cases, high-risk patients with severe symptoms, to others who are barely affected.
Patients who have positive PCRs but have no symptoms or very mild symptoms, do they develop long COVID? We just don't know.
Dr. Cliff Rosen is the director of the Center for Clinical and Translational Research at Maine Medical Center's Research Institute. He is the principal investigator of a nationwide study known as the Researching COVID to Enhance Recovery, or RECOVER initiative. With $1.5 million from the NIH, researchers will be enrolling 90 adult patients from across the Maine health system. In Scarborough, Vivian Lee, News Center, Maine.
The RECOVER study is expected to take 4 years to complete. If you'd like more information, you can log on to our website or the News Center Maine app.